I'm Elisa Gretz Friedman. I'm the director of the Menopause Center of New York at Mount Sinai. I'm an assistant professor at the Icahn School of Medicine. Menopause is defined clinically as the permanent cessation of menses. It is a clinical diagnosis. The average age is 51 and a half. Um, Despite the fact that a woman's life expectancy is now increased to beyond 80. Um, Women are born with all the oocytes or eggs that they're ever going to have, and menopause is when those eggs run out. Um, so the final menses reflects the depletion of all her eggs and the cessation of hormone production by the ovaries of estrogen and progesterone. The final menstrual period is preceded um, for several years prior by the perimenopause or the menopause transition, as the oocytes are or the eggs are running out. They become less responsive. Early perimenopause can begin 5 years prior or even longer prior to menopause. And it is um, marked by a slight change in a woman's menstrual cycle to plus or minus 7 days. So she can have a 21-day cycle and then a 35-day cycle. Um, During the early perimenopause, um, the hormonal fluctuations tend to have an increase in her estrogen at times. And women can experience increased breast tenderness or increased bleeding. The late perimenopause typically begins 1 to 3 years prior to the final menstrual period. And during that time, it is marked by a, uh, a loss of menses for greater than 60 days. And a woman is considered menopausal when she has not had a menstrual period for 1 year. Every woman is different and will experience menopause differently. Symptoms typically occur during the whole perimenopausal time. A lot of what we know of the symptoms of the menopause transition, uh, we have learned from the SWAN study, which is the study of women across the nation. It's a study that followed women, a group of women, 3,300 women in 7 different locations across the United States of different ethnicities, for now up to 18 years. And, it can be difficult to distinguish what is related to menopause and what is related to just normal aging. And that is a lot of what this study has helped us to define. The most common symptom of menopause is a hot flash, which is a feeling of warmth that can start in the chest or the face, typically lasts 2 to 4 minutes, can be followed by sweating. It can be associated with anxiety and palpitations. Um, and 75% of women will experience hot flushes. Some women have many per day. They can occur during the day, they can occur at night, and some women will not have them at all. 75% of women will experience hot flushes. They are more common in Black women than in white women, and Asian women are least likely to experience hot flashes. Um, Another symptom that can occur with menopause is vaginal dryness. Women can experience feelings of dryness or pain with intercourse related to the decreased estrogen. Other symptoms are cognitive changes. And we know that there are women can have difficulty learning new tasks. And this is only we learned this from the SWAN study. This is typically can be during the transition, but it resolves after the menopause transition. So it's temporary. Um, Women can experience difficulty with sleep. Most commonly, this is related to hot flashes during the night. Yes, typically the hot flashes, they last an average of 7.5 years. Women may have them um, with the menopause, before their menopause, with the final menstrual period, or they can come on after their final menstrual period. But typically they last 7.5 years. There are a small percentage that have hot flashes into their 70s and 80s. Um, so typically they will resolve. The symptoms of vaginal dryness or pain with intercourse is a symptom that gets worse the longer you are from your final menstrual period. Every woman will stop having her period. Um, Menopause can be natural or can sometimes be related to surgery, where a woman has her ovaries removed, or can be related to possibly chemotherapy that can cause an early menopause. So every woman will stop having her period or uh, experience menopause, but every woman does not necessarily have symptoms, and every woman experiences menopause differently. The menopause, when we talk about menopause, we're specifically speaking about the menopause transition, and that typically can last 5 to 10 years, um, from mid 40s to mid 50s, typically. Absolutely. When you see your doctor um, to discuss menopause, um, the doctor typically will take a history, and based on your personal history as well as your family history, can recommend treatments for menopausal symptoms. Um, the first thing that we always start with something that is the least invasive or the least likely to have side effects. And therefore, we first discuss lifestyle changes. And lifestyle changes that can be helpful are um, specifically helpful for hot flashes, can be dressing in layers, keeping the ambient temperature in the room down, um, ice water, avoiding triggers. And typical triggers can be, for a hot flash, can be alcohol or a hot or spicy drink. Um, Stress can be a trigger. Hot flashes are more common in um, obese women, and therefore weight loss can be helpful. There are some over the counter medications that are helpful. And then there are hormones. We can replace or give the most effective treatment for hot flashes is estrogen um, in the appropriate patient. So when you present to your doctor complaining of symptoms and you are considering hormone replacement, a full history and physical needs to be done, and it is a shared decision whether hormones are appropriate. Women with a personal history of breast cancer should not take hormones. There are other hormone dependent tumors, such as endometrial cancer, uh, which, if it is a remote history of endometrial cancer, um, that woman may possibly be able to take hormones. Other women that should not take hormones are women who have a history of undiagnosed vaginal bleeding, high, women who have a history of coronary artery disease or stroke, women who have a history of liver disease, women who have a history of blood clots in their legs or their lungs should not be given hormone replacement therapy. For the majority of other women, it is a shared decision with your doctor if hormones are right for you. In They are the most effective treatment for hot flushes, and in the patient who is going through the menopause transition, who is suffering terribly with hot flashes, hormone replacement can be beneficial. It lowers the your eventual mortality rate. It can um, decrease your history of or your risk of um, diabetes. It can decrease your risk of colon cancer. So it does have some beneficial effects in addition to the benefit of relieving your symptoms.